Welcome, everyone. Again, good morning, good afternoon, good evening, depending on where you are dialing in from. My name is Jessica Farringer. I'm the director of the Data for Impact project, and I'm pleased to welcome you today to the second in our webinar series on localizing MERL and measurement of MERL. Let's see. So today's topic is on using Sentinel indicators and network analysis to assess health program sustainability in Nigeria. You're going to be hearing from a variety of talented team members: Samson Adebayo, Emmanuel Adegbe, Sean Curtis, myself here at the beginning very briefly, Tori Taylor, and Justice Azim. Next slide, please. This webinar is presented in English with closed captioning available. If you would like to turn on English closed captioning, select the live transcript CC button from your Zoom menu. And you can see here what that looks like. Next slide. Here we have on our agenda for the webinar today, just by welcome, some opening remarks from Justice Azim with USAID Nigeria. Then we will have Sean Curtis and Tori Taylor take us through first sustainability sentinel indicators in the Nigeria health population and nutrition multi-activity evaluation. And then Tori Taylor talking about a novel metric for community embeddedness using organizational network data, also based on work in this Nigeria HPN evaluation. And then we'll have a question and answer session moderated by Emmanuel Adegbe and Samson Adebayo. And Emmanuel is with Data for Impact and Samson Adebayo is with Data Research and Mapping Corporation. Next slide. So Data for Impact, or D4I, is funded by USAID. D4I is a consortium led by the University of North Carolina at Chapel Hill in partnership with Palladium, ICF, JSI, and Tulane University. D4I strengthens local capacity to generate and use high-quality health data for strategic decisions on health policy and programming at national, subnational, and community levels. D4I investigates program effectiveness, integrates gender into all activities, supports adaptive management, and learns from evidence. D4I draws on the technical expertise that exists in each partner organization and an extensive network of local partners in USAID's priority countries. Next slide. So localizing monitoring, evaluation, research, and learning helps ensure that local actors have the resources and capacity needed for equitable, evidence-informed decision-making. Applications of this in MERL activities include local capacity strengthening, using a systems lens, engaging with diverse stakeholders, and implementing other good practices for locally led development. Today is our second webinar in this series focused on localization in MERL. The webinar series will share tools and approaches for effective capacity action planning, monitoring sustainability, including local actors' roles in complex program systems, promoting local voices through social accountability methods, and more. Please follow us or sign up for our newsletter to receive information about upcoming webinars in this series. The next webinar in the series will take place on March 27th at 9 a.m. Eastern Standard Time, and that focuses on shifting power and the need to better understand locally led capacity strengthening efforts. Next slide. With that, I will pass to Justice Azim for some opening remarks before we get into background. Over to you, Justice. Thank you. Let's turn things over to Sean to start us off talking about the Sentinel indicators work.
Okay. Thanks very much, Jessica. Maybe we can get Justice at the end of the presentation to give some remarks if he's back by then. Okay, so welcome everybody. I am Sean Curtis, and I am with the Data for Impact project at University of North Carolina. I'm going to just say hi, and then I'm going to turn my video off so for bandwidth, because I know not everybody has good bandwidth, including sometimes myself. So I will turn my video off. So I'm going to start off with a little bit of background on the evaluation that was conducted in Nigeria. So Data for Impact conducted an outcome evaluation of 4 USAID Nigeria health population nutrition activities with a focus on comparing the strengths and challenges of an integrated health programming approach with a disease-focused approach, in this case focused on malaria. The evaluation was conducted in 3 case study states, Ebonyi, Kebbi, and Zamfara, shown here. And one of the outcome domains that the evaluation examined was whether different programming approaches have different implications for local commitment and engagement and local capacity to support sustainability of outcomes. So here we're looking at localization from the point of measuring localization within health population nutrition programs. Next slide. So at the beginning of the evaluation, we developed this conceptual framework for sustainability, adapted from a framework developed by Washington University in St. Louis. So we used this framework to develop a tool to assess respondents' self-reported perception of the different elements influencing sustainability. So that's the second block of this diagram. We use Likert scales to assess these perceptions. And we implemented this sustainability assessment in 2022. Next slide. So this is an example of the results for one of the domains assessed in that 2022 sustainability study. It shows that Ebonyi, which implements both integrated and malaria-focused activities, generally scores lower on the different items in this domain than the other 2 states. And Ebonyi is shown in green here. In contrast, Zamfara, which implements malaria-focused activities, tends to score a bit higher, but it's pretty close to Kebbi in blue. We found more variability between states in this domain than in the other domains assessed. And we also found relatively little variation in scores between other domains. So this is actually the best case scenario, the one that shows the most variability. So self-reports are subject to several biases, and we wanted to complement these self-reported assessments with objective indicators across sustainability domains. Next slide. So Sentinel indicators is an approach championed by USAID's complexity-aware M&E team, comprising system proxies that can signal the need for further investigation if trends deviate from expectation. The selection process we used to identify Sentinel indicators for sustainability was guided by the portfolio-level theory of change for the evaluation, the study's conceptual framework for the sustainability assessment that I just showed you, and reviews of several other resources. Specifically, we looked at the larger sustainability measurement literature. We also got input from implementing partners on potential objective sustainability indicators during one of our results review meetings. We also looked at dashboards for Ebonyi and Kebbi associated with memorandums of understandings that each state has with development partners. These MOUs have certain indicators to track progress, and so we looked at what indicators and what domains they were using to assess local commitment and engagement within the context of these MOUs. We also looked at implementing partner monitoring, evaluation, and learning plans, and PEPFAR's Nigeria Sustainability Index and Dashboard, again, looking at the domains and the indicators that they were using. And then we looked at the results of our 2022 sustainability assessment and organizational network analysis, also conducted in 2022. Next slide. So we wanted to identify indicators for the 2 sustainability outcome domains of commitment and engagement and capacity that we had defined in the evaluation protocol. For the commitment and engagement domain, we defined 2 subdomains based on the review of the resources that I discussed in the last slide. And these were strategic health program planning and health financing. For the capacity domain, we identified 4 subdomains: governance and leadership, human resources for health, community participation and accountability, and access to essential drugs, diagnostics, and supplies. Next slide. So a set of 15 Sentinel indicators were identified to measure progress in commitment, engagement, and capacity outcomes across the 5 domains that we expect to support sustainability. Data were gathered from the Health Population Nutrition Implementing Partners, state governments, and a 2021 health facility assessment and 2022 organizational network analysis conducted by D4I, and also some of the implementing partners engaged that we were working with. The selection of Sentinel indicators used the following criteria. So first, we were looking for indicators that are feasible to populate with available resources. In other words, we wanted to be able to use existing data and not collect new data. We wanted the data to be available for all 3 of our case study states, and at least that was what we anticipated in theory, although you'll see that in practice, there were some data gaps for some states for some years. We wanted indicators that were relevant for comparing integrated and disease-focused programming. And we wanted to make sure we kept a manageable number of indicators that still represented the multiple domains of commitment, engagement, and capacity, but we didn't want to have too many indicators that were more than people could digest. Next slide. So let's have a little look at some of the results and the indicators that we used. And here I'm just going to highlight findings from some of the indicators. Next slide. So for the strategic health program planning domain, we looked at whether each state has a finalized primary healthcare annual operating plan. All 3 states reported having such plans for all 3 years, and we were able to obtain copies of the plans for all 3 states in 2022. Next slide. In the health financing domain, we looked at the percentage of allocated primary healthcare funding released as a percentage of the amount budgeted for primary healthcare at the state level. This indicator increased substantially in KEBI from 30% in 2021 to 85% in 2022. It increased steadily in Zamfara from 35% in 2020 to 62% in 2022. No data were available for Ebonyi for 2020 and 2021, and no funds were released in 2022. Next slide. In the Human Resources for Health domain, we looked at the percentage of primary healthcare centers that had at least 5 healthcare workers assigned or employed. This is consistent with the basic healthcare provision fund requirements. We only have this data for 2021 as it comes from the 2021 health facility assessment. KEBI has the highest percentage of primary health centers with at least 5 healthcare workers, while Ebonyi has the lowest. Next slide. In the governance and leadership domain, we looked at the percentage of primary health centers that offer a full range of primary reproductive, maternal and child health services, that is family planning, antenatal care, intermittent preventive treatment of malaria and pregnancy, tetanus toxoid immunization, and case management for simple uncomplicated malaria. This indicator is adapted from the MOUs for KEBI and Ebonyi, which use service availability indicators as outcome measurements of governance and leadership. We took this indicator from the evaluation health facility assessments that only have data for 2021. The percentage of primary health centers that offer all these services is highest in KEBI and lowest in Zamfara. Next slide. One of the indicators that we looked at for the community participation and accountability domain was the percentage of primary health centers that reported having a routine system for eliciting community input into facility management decisions. In 2021, most primary health centers reported having such a system, and in all three states, but the percentage was highest in KEBI and lowest in Ebonyi. In the second half of this presentation, Tori will discuss the organizational network indicators we also use in this domain, and with a more innovative approach. Next slide. So in the final domain, access to essential drugs, diagnostics, and supplies, we looked at the percentage of primary health facilities that had malaria rapid diagnostic tests in stock at the time of the health facility assessment, and the percentage that reported stockouts of malaria rapid diagnostic tests and of ACTs in the past 4 weeks. Stockouts in the past 4 weeks were higher in Zamfara than in the other 2 states, but primary health centers in Ebonyi were least likely to have rapid diagnostic tests in stock on the day of the health facility assessment. Next slide. So what did we learn? There do not appear to be strong systematic differences in Sentinel indicator status between states where HPN activities are implementing an integrated or a disease-focused approach, or a combination of the two. KEVI, which implemented the integrated approach, tends to perform best overall across the different domains, ranking first across the 3 states for most of the indicators in most domains, except for the availability of essential diagnostics, drugs, diagnostics, and supplies, where it typically ranks second. Zamfara, which was malaria focused, and Ebonyi, which implemented a combined approach, performed similarly overall, but Ebonyi tends to be weakest in the health financing, human resources for health, and community participation and accountability domains, while Zamfara tended to be weakest in the governance and leadership domain, in other words, the availability of services, and the essential drugs, diagnostics, and supplies domain. It is likely that a variety of contextual factors contribute to the sustainability of the system strengthening efforts, such as the political economy, state priorities, and other programs operating in each state. On a methodological level, we found more variability across states in each domain and between domains for the Sentinel indicators than we found for the self-reported Likert scale measures we collected in 2022. We believe that this supports the use of objective complexity-aware methods such as Sentinel indicators. We also collected qualitative data in key informant interviews and focus group discussions and through most significant change that have provided complementary data on the sustainability domains, and which has been useful to triangulate with and contextualize the quantitative data we have collected. Next slide. And with that, I will hand over to Tori to talk more in more detail about measuring community embeddedness. Thank you.
Thanks, Sean. Hi, everyone. My name is Tori Taylor. I'm the Technical Director for Data for Impact and was fortunate enough to have a role in this evaluation. So I'm going to talk today about one aspect of this work, and in particular, how we applied organizational network analysis data to this Sentinel monitoring indicator exercise. So first, we're going to talk a little bit about this particular element in the sustainability framework and how we operationalized it. As Sean mentioned, this was defined as encompassing program community partnerships, community involvement in program activities, and local accountability and ownership. So we had first, like Sean said, identified 2 community embeddedness relevant indicators for Sentinel monitoring, and they came from the health facility assessment and existing system data. And just to refresh your memory, those were the % of wards in program areas with functioning ward development committees and the % of PHCs with systems for community input. These met the criteria that Sean mentioned. The data were readily available, and they aligned well with the constructs we were trying to measure. But localization supports sustainability primarily by shifting power in program systems, so changing the roles and relationships that different organizations have. And the existence of these kind of forums for community engagement, even well-functioning ones, didn't seem to capture this entirely. Next, please. So enter the organizational network data. This is a rich source of information about the actors and relationships that make up the HPN activity systems in each of the case study states. And as we said, the evaluation was designed up front with this organizational network analysis, or ONA component, to capture collaboration and coordination among program actors. In other words, we'd already conducted a network survey with representatives from the HPN activity implementing partners. I pulled a few quotes here from different documents, principally from USAID, that really emphasize the importance of data about organizational relationships for understanding sustainability, including how localization is happening and contributing to sustainable programs and outcomes. Previous analysis of the ONA data for this evaluation had focused on kind of typical measures like the density and efficiency of exchange in each state. And we, in particular, had looked at information and non-monetary resource exchange. At that stage, we had also started exploring new measures that might talk about the potential for shaping relationships in support of greater sustainability. For example, we had initially done some modeling to identify relationships that didn't yet exist in the states, but that had very high potential to shift the position of government organizations into more central roles. Next, please. So to add to the two Sentinel indicators I referenced in this domain, we started talking about how network data could tell us something more about community embeddedness in the state's program networks. Here are just a few. Some of these you could probably tell are really straightforward, and others were a little more conceptual. We weren't quite sure how we would operationalize them, but we thought there was potential there. Next, please. When we were trying to narrow it down to a single metric, we talked about these two in particular. The percent of community organizations that exist in programs networks was intuitively appealing because it's pretty simple. It's easy to understand, but that's a population focused measure that doesn't say a lot about the structure of the network. So it seemed to be kind of missing the relationships component that's so important to systems thinking. This measure called betweenness centrality, on the other hand, is structure focused. You can see the difference in these simplified graphics. A network that has, for example, a lot of community organizations, but where they're positioned on the periphery of the network rather than central, that probably isn't super sustainable. And likewise, having just a few community organizations in a network can play an outsized role in sustainability if they're highly central. Next, please. In the end, we opted for this measure of betweenness centrality that reflects how important organizations are to the transfer or exchange of something across a network. And as I said, in our case, we had data about exchanging information and resources other than money. We calculated a measure that compared the centrality of community organizations to the centrality of non-community organizations. This is called relative betweenness centrality. And technically speaking, community organizations' mean betweenness centrality is higher than the betweenness centrality of this percentage of non-community organizations. So it's reflected as a percentage. And again, we were theorizing that networks where community organizations are more highly central are probably also more sustainable. We ended up choosing a definition for community that included subnational government organizations. And this aligns pretty well with USAID's definition of local actor or local entity, and also some pertinent guidance from the UN. And there's a link to that on the slide. If everyone could just take a quick look at the graphic on the right hand of this slide, the red dots are the organizations that have the highest betweenness centrality. You can just look and see if you can identify one or more green dots that you think have the lowest betweenness centrality in this hypothetical network. So just look for one or more dots that you think have very low betweenness centrality here. Matthew, if you could just click through, we'll show what those are. So the orange ones have the lowest betweenness centrality in this network. And you can see they're not brokering or exchanging anything. They're only receiving whatever is represented here. So betweenness centrality is always 0 for an organization unless it's both receiving and sending something. Next, please. Okay, so now that we've had some practice looking at a network graph and thinking about betweenness centrality and how it's represented, here are some more graphs that show resource exchange networks in 2 states from the evaluation. The green dots are community organization. Matthew, if you could just click. So there at the bottom, you can see we've circled the community organization color there, that green or teal. So we're looking at that to see where community organizations are located. And at a glance, can you tell in which state community organizations are more central compared to non-community? Matthew's going to pull up a poll now so you can provide your answer. So where are those green dots more central? If folks want to go ahead and provide their response, I'll give you a minute. So is it Ebony or is it Zamfara? Matthew, I'm not sure if you can see when folks have responded, but go ahead and use your judgment on when to reveal that answer. We have that response yet, Matthew? Okay, good try, everybody. It's actually Zamfara. Matthew, if you want to go back to the slide, we'll highlight that response. So the relative betweenness, centrality, and Zamfara is 84% versus 70 in Ebony. And you can see these networks are pretty dense, and we have a lot of representation of community partners here. So it's not super obvious. This difference is not a huge one. Thanks, Matthew. Next, please. Next, I'm just going to quickly share the relative betweenness centrality results for all of the networks that we looked at in this evaluation. Recall that we examined 2 kinds of exchange in 3 states, so there are 6 networks to look at. We won't spend a lot of time examining these results in detail, but there are links to more information in the presentation, which you all will receive a copy of, and that includes the full evaluation results reports and some briefs. And I'm going to provide a few summary points about these results at the end of the presentation. Next, please. First, we'll look at states' information sharing networks. This is Ebony, and 63% of non-community organizations have betweenness centrality values below the mean for community organizations. Next, please. Here in Kebbi, the result is a little bit higher at 78%. Again, the green or teal dots represent community organizations in this network. The blue are non-community, and the size of the circle indicates the level of betweenness centrality. Larger circles are more central. Next, please. I'm still looking at information sharing networks, this time in Zamfara. This one at 79% is almost the same as what we just saw in Kebbi. Next, please. Moving now to the resource sharing networks. Again, this is non-monetary resource sharing. The relative betweenness centrality in this state, Ebony, is 70%. Next, please. It's higher in Kebbi at 81%. And lastly, next slide, please. It's higher still in Zamfara, but not dramatically so, at 84%. Next slide, please. So what did we learn? First, you saw that all of these results are above 50%, meaning that the average betweenness centrality for community organizations exceeds that of most non-community organizations in these networks in every state. Just to remind you, the range was actually 63 to 84%. Community organizations' relative centrality overall was slightly lower in Ebony than in the other 2 states, but we ran this analysis with subnational government organizations classified as non-community also, and we did that state difference basically dropped out. Also, community organizations have higher relative centrality for resource exchange than for information sharing. So a program that relies heavily on information exchange to function effectively or to sustain itself might want to focus on strengthening these networks. But again, across the board, community groups are already quite highly central. And finally, this analysis gave us a lot to think about. For example, what can a novel metric like relative betweenness centrality tell us about how localized programs are, what they should be aiming for, and the probable effects on sustainability? How can we interpret these results alongside other Sentinel indicator findings and over time? How can we improve network data collection and optimize decision-making about how organizations are classified as community, non-community, local, non-local, etc.? And lastly, expanding this kind of work could help guide localization efforts and related efforts in diverse contexts by providing us with objective information that originates with local stakeholders and others about how they work together and highlighting opportunities for more effective, equitable, and sustainable collaborations. Next, please. Just want to thank the full team here. You can see there are a lot of people involved in this work. Some folks you heard from today and others who aren't here with us. We also had a US-based consultant supporting the analysis of the network data, so I want to make sure to recognize him. Next, please. And now we're going to turn it over to folks in Nigeria to talk us through Q&A. Hopefully some questions have arisen from you all as you've heard us talk about these results. Oh, Jessica and Sean, thank you so much for reminding me. We are actually going to hand it over to Justice with USAID Nigeria for the mission's perspective on this work. Thank you. Sorry, Justice. Turning it over to you.
Yeah, thanks everyone, and apologies for the initial hiccup with technology. But truly, we are really happy to have you be part of this webinar. And just to say, I actually wanted to say a quote from the USAID administrator, Samantha Power, where she says, if we truly want to make aid inclusive, local voices need to be at the center of everything we do. And in the past couple of years, USAID as an agency is really working to increase our commitment to shift more leadership for both priority setting, project design, implementation, measuring results to local organizations, institutions, and people. And of course, the aim of all this is to put local actors in the lead, to strengthen local systems, to be more responsive to local communities. And one of the challenges we've had is that we often find difficulty to get the right metric to measure aspects that help us understand dimensions to sustainability, dimensions that show increasing capacities to local entities and institutions, and just basically help us to understand the progress we're making in advancing the localization agenda and sustainability in the country. So we are really excited to be able to have D4I help with this work in Nigeria through this multi-year evaluation. Of course, Nigeria is a very important country. It's the most populous country in Africa with over 216 million people. And we've seen stagnating health and human development indices across the years. So really having data that helps us to understand the progress we're making and to see, aspects of our work and how it's being sustained is really critical. So I think that the D4I team has done a very good work of trying to make sense of the data. And it's exciting for us to be able to look at all this data and be able to make comments and draw insights from it. So really welcoming everybody and just happy to have everybody be able to make our time to participate in this important webinar. Thank you, and over.
Thank you very much, Justice. I think we may have lost Emmanuel. Emmanuel, are you back?
He's not back.
Okay, we'll move forward then. I actually had a question prepared. I don't see any in the chat box right now, but I was wondering, Professor Adebayo, if you could speak to us a little bit about the process of collecting the network data, maybe in terms of how respondents were able to or not able to identify their collaborating organizations, answer questions about specific kinds of exchange, or anything else that stood out to you in your role collecting the network data. Over.
Thank you, Tori. I hope you can hear me at the other end there. We have some challenges with network. Yeah, in the course of conducting organization network analysis, there were no much challenges as one would have anticipated, apart from a few issues which are not so substantial to have affected the quality of the activities in Kebbi State, and this varies across the 3 states. For instance, in Kebbi State, the participants who were part of this exercise were actually knowledgeable enough to understand the issues for discussion in terms of identifying collaborating organizations. They didn't find it difficult. However, they may not be able to remember the names of the organizations, but because they meet regularly, at least once in a month, this gave them opportunity to understand and know themselves. In Ebonyi State, they have little challenges in terms of naming the kind of organization that they collaborate with. This was only prominent in Ebonyi State. In Zamfara, it wasn't an issue at all in Zamfara. However, there were only a few organizations that they were actually collaborating among themselves there, but they know themselves and they were able to be able to recognize and name the organization. However, sometimes during the course of this exercise, they couldn't actually mention the actual name of the individuals. However, they will remember the organization in terms of, because they have been meeting on a regular basis. So generally, I think it wasn't more of a challenge in terms of recognizing the organization that they collaborate with. So this was not of any challenge to them. Thank you.
Thanks, sir. Just adding from the perspective of someone who was involved in cleaning and preparing those data for analysis, another challenge was that we had to standardize the results. So sometimes people would provide the name of a project versus an implementing partner, or give a slightly different name for the same organizational entity. And we had to go back and clean those, and it involved an iterative process, mainly with local stakeholders, to understand which responses actually should be coded together under a single response. Over.
Yeah, thank you, Tori. I think this was one other advantage that we would say about ONA in terms of ability to get back to the data collectors and clarify some issues, and the data collectors, that is the research assistants, were able to provide adequate responses in terms of any issue that were raised from D4I UNC. So I think it's also of an advantage in terms of implementing ONA. Thank you.
Thank you. Another thing that occurs to me is that, as we said, part of our criteria for the Sentinel indicator selection overall was that they should use existing data and be relatively easy to obtain. And we had the advantage here, obviously, of implementing this work in the context of a larger, well-resourced evaluation. So while for us, it was easy to access health facility assessment and organizational network assessment data, those are major resource investments. So in other contexts, especially with the idea of collecting Sentinel monitoring data over time in repeated rounds, that represents a pretty major investment of time and resources. Over. If we don't have other questions from the audience yet, I was interested to ask Justice if you might be able to speak on how the mission has used or intends or would like to use the results from these exercises. Over.
Yeah, so I think from the mission's perspective, it's really been really interesting. And I think one of the things that we kind of considered is the fact that, especially from the data from the Sentinel indicators, it just kind of made us realize that we needed to pay a lot of attention to political economy. So we had to actually look at doing further analysis by doing a political economy analysis, largely because there are some of the indicators or some of the outcomes of interest in terms of sustainability that are actually what we would say like intangibles. I mean, like they are difficult to measure. So things like political commitments. So in Nigeria, we are seeing a lot of some of the outcomes that we desire are really tied to political commitment, and they are really built around powerful individuals. So we see that the state governors, for example, are really very powerful. So even when you have annual operational plans developed, or where you have those documents laid out in terms of actually implementing these plans in such a way that they translate to health outcomes at a population level, we are seeing that it's difficult to have metrics that kind of push the government in that direction. So we actually had to do like a political economy analysis to understand the power dynamics that really help to get the government from having documents created to having things like budget releases, for example. So we see areas where the government is we're able to sometimes push the government to make a commitment to increase budgetary allocation to health. But then when it comes to actual spending on health, we are seeing challenges. Then we had some issues with contextualizing the effect of other things that are beyond programs control. So like the issue of COVID, when COVID hits, and then there was a lot of diversion of government resources and all that. So though it just kind of made us realize that in looking at the Sentinel indicator approach, we also needed to do a bit more qualitative understanding using political economy analysis. Then for the network analysis also, I think one of the things that really stood out for us was we really appreciated the fact that we saw the collaboration and the role and the part that other institutions played in states, because in the study, we kind of found that out that a state like Ebonyi State really stood out. And I think one of the ways is that the network analysis actually helped us to understand some other organizations that we were not typically considering as important to work with. And then we actually had to have the implementing partners in those states become more intentional about partnering or engaging increasingly with those organizations to improve the outcomes of interest. So it's really been very exciting and interesting findings for us, and just kind of highlights a little bit more work that we also need to do.
Sorry, there is a question in the question and answers box.
Yeah, I can take that one if you like, and just talk a little bit about it. So the data collected come from a few different time points, actually. For the Sentinel indicators, for some of the indicators that are coming from sort of records, and we had data like the finance data, for example, is reported annually, at least in Samfara and Kebi on their website, so you can go in and look at that annually. So we had data for 2020, 21, and 22. For the some of the health facility assessment data was only collected and available for 2021, and then the organizational network analysis was collected in 2022. So it's really spanning about a 3-year period, and different indicators had different things. And Jessica, do you want to add something to that?
Yeah, just to mention, thank you, Sean. Just to mention, data collection was actually in March 2022. We trained in the last 3 days of February 2022, but data collection actually took place in March 2022. Thank you.
Great, thanks.
Yes, that was. Oh, sorry. Go ahead, Emmanuel.
Sorry, I dropped off. The question about dissemination, has it been answered to all states?
About dissemination, no.
Not yet. So, Dr. Manuel, you can answer that.
Yeah. So, hi everyone. So my name is Manuel. Just show my face briefly. Then, yeah, I think that question. So, yes, we had made an attempt to disseminate to the states as part of the broader evaluation, rather than just the ONE and all of that. So it was part of the sort of feedback we provided first of all to USA International, then to the partners international, and we had a chance to send it to the states, the 3 states. One, because of the security challenges for 2 of the states in the north, Zamfara and Kebbi, particularly Kebbi, we had to do it virtually. the other one, we also, it was virtual, so that we didn't get as much in terms of participation, right? But the one for when you went there in person, and it was like Justin mentioned earlier, it was very interesting to see that IPs and partners who, when they saw the whole network diagram and some the sort of relationship and partnership that they could take on, it was something that was an eye-opener, and they thought they could explore, particularly in those that were community-based. Just last thought for now. Over.
Yeah, I see there is a question in the chat from Charles Katende. I just need to, oh, I've somehow lost it in the, just make it pull my chat back up. But I think Charles was asking about whether there is any plan to include any of these types of indicators in the health information systems, right? I think I will start, and then I'll ask if any of my other panelists want to address that. I think we were looking at, I think the types of indicators, I think we have to be sort of balanced how much information health information systems can take with, and the types of information they can take. So in principle, some of the types of indicators we looked at for Sentinel indicators could come from routine health information systems. For example, some of the questions around human resources for health and around service availability that we looked at under governance and leadership. Some of those kinds of indicators could, in principle, be obtained from routine health information systems. One of the challenges we had was some inconsistency between the health facility assessment and some of the routine health information system data we had. So in this case, we used the health facility assessment. But I think looking for relevant indicators within routine systems is ideally the way to go, because then you would have those data annually and wouldn't be relying on external surveys, but while balancing that against not overburdening those systems and recognizing that not all of the information is suitable to be collected, for example, in the facility information system. But human resource for health systems, the logistic management information systems are potential sources on essential diagnostic drugs and supplies. We could get the budgetary information we were pulling from routine reports that were published by state governments. So I think there is definitely potential around that. But I'm going to ask if Emmanuel, if you would like to add anything to that, or anybody else on the panel.
Yeah, you're right. So ideally, this should be available. So in states that are having some direct support by partners, for instance, the human resource database is much more developed as compared to some states that don't have as much support. But then over time, the expectation is that once you have some of those databases, well structured and institutionalized, then it will be easier to become, to get more routinized, such as similarly with LMIS. Some states that have a lot more partner support, you will have some of those systems more developed as compared to others. So and also for those finance sort of data, some states are quite advanced compared to others. So the challenge is being able to have as much consistent information. For instance, you saw what we presented where in Ebonyi, we had challenges in getting some of those financial data compared to that. So those are really the challenges we've been able to, which is why sometimes you start trying to go out to collect these sort of Sentinel indicators, primarily, which shouldn't be.
Great, thanks very much, Emmanuel. I do think some of the ONA data is more of a separate analysis that would not obviously lend itself as well to this kind of routine collection. Jessica, do you want to go ahead?
Yes, sure. So we're curious whether any of you as participants have experience measuring sustainability or localization. So if you could raise your hand or put a note in the chat, yes, I have that experience. So at a minimum, it'd be great just to see how many people have that experience. And then if you'd feel comfortable saying a few words about what kind of measurement experience you've had, I think that'd be useful for the group. as well. We could open up mics. So why don't you go ahead and raise your hand if you have experience measuring either of these topics, or if you're having trouble locating the ability to raise your hand, it's at the bottom of the screen. Write something in the chat. We'll give you a minute for that. Okay, well, it looks like nobody is indicating that they have experience measuring sustainability or localization. That's interesting to us. It's definitely a new measurement area. Another thing that it would be interesting to hear is how the information that you learned today can be useful for you. If you had thoughts already of ways that in the future you might be measuring these topics, that would be helpful for us to know as well, because this is an area that we're actively working on and trying to determine what the gap areas are and what people's interests are. So if anyone it feels comfortable opening your mic and saying a few words about how you could use this information you've heard today, or just putting a note in the chat as well would be helpful. I see Charles Katende, you have your hand raised. Matthew, could you open Charles's microphone? Charles, if you could say a few words about how this information, how you'd be planning to use this, or how this is helpful for you.
Hello, yes. Yes, good morning, everyone. Good afternoon. My name is Charles Katende from UNFPA. Thank you so much for this webinar. I think the information is very exciting. I'm very much interested in this measurement. Of course, you call it sustainability, but from our side, we are interested in this kind of information because we want to use it as part of the outcomes of maybe the policy dialogue support we do, or the advocacy we do for the domestic resources and domestic commitment to really take forward the agenda of sexual and reproductive health. So this kind of measurements, which I'm seeing here, is really helps us to measure to what extent we have managed to get, for example, the national governments or the local communities to really participate into, owning and taking forward the sexual and reproductive health agenda that we really work on from UNFPA perspective, because we focus on, for example, on ending unmet need for family planning, preventable maternal death, whether it's gender-based violence, but really the point here, why I was interested in this is really one of the measures that we want to see, to use to know to what extent we have actually made inroads in making this agenda owned and taken forward by the communities themselves. So that's why I was very much interested, and thank you so much. I didn't know about the betweenness and centrality, that kind of thing. So that was also very interesting. So that was my comment, basically, not much question, but thank you so much.
Great, thank you, Charles. That's helpful information for us to have moving forward and planning these kinds of webinars and resources on these topics. And let's see, is there anybody else? We have 1 minute left. There's any last questions or anybody else's comments on how you think that anything you've learned today could be potentially useful to your work? We'd love to hear that.
Jessica, Laura Voss noted in the chat that Momentum has mapped their measures to the new USAID localization measure. That would be the local programs indicator reflecting good practices for localization.
Thanks, Tori. Laura, was there anything else that you'd like to say about that?
Hi, yes. I just think it's a really interesting space that we're in right now to look at measures and how we are, both the definitions and what are the 14 best practices, but also what else the awards are measuring, and how that those indicators together give us a picture of what kind of localization is occurring. And I think that's really interesting. Also, I just wanted to point out, I think the O&A work is fantastic and we should be doing more of that. Thanks.
Thanks, Laura. Okay, we are at time. Thank you so much, everyone, for joining today. We have been recording this webinar and we'll share the recording link with you afterwards. And if you have any follow-up questions, please feel free to submit those to our D4I email address that the webinar recording link will be going out from. And I hope that you all have a lovely rest of your day or evening, wherever you may be. Thank you.